What is vocal nodule? See, there is a callus formation, that is thickening in the vocal cords. So first of all, what is vocal cord? Vocal cords are two shelf-like projections within our larynx, that is the thyroid cartilage of the larynx. These two shelf-like projection vibrate. So the air coming out of the lungs through the larynx or the voice box, when there is vibration, there is a production of speech. So there is abduction. When there is abduction of vocal cord, there is a mild speech. When there is adduction of vocal cord, there is a loud speech. When you take a deep breath, there is abduction of vocal cord. When you want to produce a loud voice, there is adduction of vocal cord. The vocal cord can also get tensed or they can get relaxed. When it gets tensed, you can produce a loud voice. When it gets relaxed, you will produce a whispering voice. So this vocal cord, due to repeated trauma, due to voice abuse, like for example in singers, in teachers, in screamers, in coaches, trainers, so there will be a trauma to the vocal cord resulting in nodule formation, callus formation, that is called as vocal nodule. This vocal nodule, due to repeated trauma, can also come due to smoking, sinusitis, allergy, anything which irritates the vocal cord, including the reflux disease, gastroesophageal reflux disease, also in hypothyroidism. All these are etiologies for vocal nodule. So whenever the person has got a vocal nodule, when smooth vocal cords are there, when they move across one another and when they move away from one another and when they get tensed and relaxed, the movement is smooth, so there is no change in voice. But once there is a nodule over there, the movement within the vocal cords will be altered, resulting in hoarseness of voice or change in voice. The quality of voice, the timbre of voice is affected. The person cannot speak continuously for 1 minute because there is voice fatigue, and then tiredness is there. So slurring of speech is there, especially in the vocal cords. That slurring is, they feel their voice is become harsh. So those are the symptoms of vocal cord. Some people also feel pain in their throat because of the trauma which has occurred in the mucous membrane of vocal cord. So easily we can diagnose this by doing laryngoscopy. We can see a nodule present in the junction in the vocal cord between the anterior and posterior halves. There will be a nodule. Usually it is bilateral condition. Initially starts on one side, later it's on both sides. So this is about also stroboscopy. Also you can be used to diagnose the vocal cord vibrations by throwing a flashes of light over there. The treatment includes voice rest. That is, we have to tell the patient to give rest to their voice for at least 5 to 7 days, followed by speech therapy. They have to speak in a medium tone, low tone, not in a high pitch voice. That is speech therapy. So all these are treatment for vocal nodule. Hope this helps. Thank you. Bye.